Hi, everybody. Really excited to be here, and thank you, Rod, for the introduction. I think, as I was attending different panels, I was really excited to hear the dialogue between the technical people and people coming from the domain knowledge, the physicians, the clinicians, the people working in the healthcare field, and that are really eager to understand how to apply this technology to solve some fundamental problems. And I think Charles touched upon many of the practical topics, how we can, apply this technology. And to continue the remarks that John Boss made to kick off the day today, we see that things are moving in a practical direction, right? So we see maturity, we see that our use cases that are being implemented and talked about that are geared towards production. And as we move into production, it's very important to build things on the right foundation. And as somebody who spends a lot of time talking to companies about different blockchain and DLT projects, from a practitioner standpoint, and somebody who's been around and lived multiple IT shifts and revolutions, I think it's important to apply the new and emerging technology, and especially disrupting technology such as blockchain in the right way. And I think if we were to pick on one of the key fundamentals pieces of DLT that enables it, it's identity. And we've heard from many people that identity is a very, very important topic when we talk about healthcare. So we need to use the standards and agree how do we implement identity correctly so we can really build the future. So I thought I'll open up my presentation with a question, but I think it's a very, very important question when it comes to identity, says who. To consider why that's an important question, I think we have to think about identity. So identity is actually many, many different things. So it's not just my name, where I live, but it's many different things that define who I am depending on my persona, depending on what I'm trying to do, depending on my use case. So if I go to a doctor, that's obviously my coverage, it's my medical history, maybe my diagnosis, my consent to do different things. If I'm being employed, it's obviously my credentials, who I am, what did I study, my employment history. If I'm a parent, that's certain things and so on and so forth. So there's lots and lots of credentials that I need to use when I go about my life, right? And as our lives become much more connected, much more digital, the ability to communicate about your person, who you are, and why you're entitled to certain things, why people should trust you, really depends on us presenting credentials. And when you present credentials in a digital way, you have to answer the question, says who, right? Why is that true? Why should we trust this credential? So that's very, very important fundamental question. So when we talk about healthcare, obviously, as person has multiple different personas. You can be a member of certain coverage program. You can go for treatment as a patient. You can be a consumer to buy certain devices or certain prescriptions, sort of, over-the-counter drugs. And you go about and actually interact with the different players within the ecosystem, and you provide your credentials, who you are, information about yourself, your healthcare record, your coverage, and many different things. And what's interesting, in many different cases, you actually provided information to people who type it into the system, which ends up in different silos, in different parts of the ecosystem. And it gets worse, because once you've done that, you basically lost control of your data, and the data becomes stale, it goes out of date, and it's being shared between different players of the ecosystem, and sometimes you don't know what's being shared, and maybe you've given a consent for somebody else to act on your behalf years ago, and you forgot about that, and the person's no longer with you. So, it's less than optimal. It actually creates lots and lots of different issues. So it reduces trust and displaces control of personal data. So how can we address that? And I think, one of the important things when they think about decentralized technology is to use decentralized technology for identity management as well. So from my standpoint, and many experts agree and work on the solutions, that we have to consider self-sovereign identities. And I will define what self-sovereign means, because sometimes it's misinterpreted. So the idea there is actually fairly straightforward. Depending on your persona, depending on your context, as you interact with the system, you basically provide the digital information, digitally signed information to different players, so which gives you access, and people can identify who you are and get access to your history. And because it's digital, because it's signed, you can create audit trail of that information when it's been provided. You can record the fact that consent has been made, and if it has to be shared, it has to be enabled by you. It has to be enabled by that person, by your persona, and can either be enabled by you providing information directly because you own it, or you can give a key to other people to access that information so the consent and access is clear, right? So I hope you agree this is a much better state than we had in the previous picture. So obviously, many people thought about identity, and I think that we probably have one new startup every month or so now trying to create identity solutions. I think that's problematic. I think that for especially in enterprise adoption, it's very, very important that we have standards, because otherwise systems are not going to be interoperable. We might create more problems than we solve. So, and I want to introduce to Decentralized Identity Foundation. It's a group of companies that's been started about 2.5 years ago by big players such as Accenture, Microsoft, and some startups such as Evernym, Sovereign Foundation, and others. And today, it's about 80 something, more than 80 companies, I believe. And what they work on, they really try to define the standards for decentralized identities that are anchored to blockchain IDs, linked to zero trust databases, universally discoverable for people, organizations, and things. So they really cover that big spectrum. Now, what's interesting, I mean, this is obviously a consortium, and at the same time, there's a standards organization on the W3C side that defines different web standards. They have a couple different groups. One of them credential working community group. The other one is verifiable claims working group. And I explain in the next slides what they are. So basically, it's a very straightforward and simple idea, but very, very powerful. So you start with using something called Decentralized Identifiers, or DID, in DID documents. And these are key enabling blocks. When these people got together and started to think about it, and you have to appreciate the fact that these people, most of them come from years and years of digital identity and privacy background. And they use this knowledge to sort of see, well, how can we build a new beginning for identity for the decentralized world? And they focused on, okay, self-sovereignty, it has to be proof-based, it has to be portable, discoverable, it's going to be simple to use, right? Those are all different design goals that went into it, so it's a big effort. And what you basically do, you start with a simple identifier, which basically says the ID, then it says the discovery method, and then the actual ID of a person. And then attached to that, you're going to have a DID document, which is basically a JSON document that defines, various meta information about that ID, such as, where it's coming from, who it's related to, the public key that's used to sign things related to that identity, how you can contact that person, and many other different things. So it's very, very expandable. You can use it in a sophisticated ways, and you can discover more online on Ask Us. We will be happy to talk you through that. So, and sometimes, when we talk about self-sovereign identity, people get it wrong. There's certain myths like, it's self-issued, it's opposing government and different things. It's actually not true. So the self-sovereign term means, and what you see on the slides here is actually the trust model. So sovereign means is that I, as a holder, I am responsible for keeping information and storing information about my claims. And claims are, essentially attestations. So self-sovereignty in this case means that I'm responsible for sharing that information and keeping track of that information. But the trust of the information comes from the issuer. So issuer can be a bank, can be a doctor, can be a government and DMV office and so on and so forth. They digitally sign and provide the claim to me that I store. And I have to trust my store, and I have to trust that the claim that I received from the issuer is correct and verifiable and belongs to me, right? I then go and provide that claim to somebody that we call inspector verifier, and basically then inspector verifier can use digital signatures to verify that, yes, this claim is coming from a trusted issuer. And underlying all of that, of course, there's a digital identity registry that just stores the public keys that can verify actually, yes, it's coming from the right source, right? And so what we've done, we basically decoupled the relationship between the issuer and verifier. They don't have to have direct relationship. The relationship is mediated by the person who owns the information, who controls the information, right? So that's really the important part. And then, of course, we have to trust that the ledger that stores the public keys and we can rely on to verify where identity is coming from or claim is coming from has to be, incorruptible or at least amendable if we have to correct some sort of loss of keys and so on and so forth, right? So just to give you an example, I guess a very, very simple example, I can go to my peer or maybe my program provider and get the claim that I have certain coverage. I receive that claim around my ID that's specific to that relationship. I then go to personalized medicine supplier, for example, engage into some sort of subscription or procedure, and then I provide the claim. And the claim basically looks like you see over there. So it's not important, what's in there. I mean, there's some signatures, there's some other data, the type of claim I'm providing. And the important thing, I guess, is that this DID standard, when we talk about the ledger and how you store the data, is actually supported today by multiple different projects. So you can use that identifier to resolve to multiple different providers and basically start building for the future for interoperability and use this technology to solve these problems. So what does it have to do with blockchain? And basically, what we heard from Charles and others is that, as I start interacting with the system, right, as I start connecting and going through different procedures, maybe I need to go to a doctor, the doctor needs to get access to my history, I provide the keys for them to access that history, or maybe provide that history myself if I so choose, right? So that can be flexible essentially, right? Then the doctor determines, well, actually we have to go to special person who specializes in my diagnosis. I go there and they have to interact again with the history, understand my coverage and so on and so forth. Then maybe have to send me to a laboratory to do some tests. And again, I interact with that. And then finally there's prescription. I have to go to a pharmacy, pick it up and so on and so forth. As I interact with the system, there's obviously business process that's happening to help me interact with different parts of the system to receive the treatment that I want. And that, of course, is where we can use blockchain, right? So I use personalized information and claims about myself to facilitate this business process that's going to come across and provide peer-to-peer relationship, and there are privacy enhancing between different providers that interact with me and provide the care, right? So that's essentially the idea. So, one thing that we find is that, obviously, when we think about DLTs and blockchain, we have to design the applications. You might have heard that, well, you have to use this blockchain or that blockchain. In reality, you have to map your business use case to various layers that define any type of DLT or blockchain. And it's so-called 4C model. So you start with the communication layer, and you define who communicates. And in this case, of course, it's your primary care, your pharmacy, your hospital, specialty care providers, laboratory, public health, and many, many other entities, right? What do they communicate about? That's your content layer, or you can think of it as a data provenance layer. Your health records, consumer health devices also provide some information that you actually want to manage, who sees that, so it can be very sensitive information. Lab results, general profile, maybe your genetic data, especially when we talk about new types of medicine, and finally consent, because we don't want to store the actual identity on blockchain. We don't want to store PII and PHI on blockchain, so that's very, very important. Finally, when we talk about consensus, not from technical standpoint, but from business rules standpoint, the data governance standpoint, if you will, people have to agree that transactions are correct, so they have to have the right proofs, identity of data, the patient consent, and maybe this data doesn't have to go to everybody at the same time. So we want to make sure that only the right people see it, especially when it comes to business relationship. And finally, at the very top, we have so-called smart contracts, and the way to think about them as a pieces of programmable agreement, something we can automate on top of these transactions. And that would be data access rule governance, that would be financial relationship, the charge capture, claim adjudication, billing and collections, and other different things we can add. And you can see already that here we can make the system very expandable, and that's the beauty of blockchain, but unless you have the right information about who you're interacting with, what they're entitled to, and what the right history is, you cannot really build the system. So that's why identity is so foundational to distributed ledgers. So how can we solve that? How can we make sure that identity information is not being stored on the ledger? And how can we make it productive? As we on our journey as a technology and consulting company, as we started to engage into these projects and look at different, DLT technologies out there, we basically thought, well, the good design pattern is separation of concerns. And clearly here, when we think about it, there's very clear orchestration part, right, that I've just talked about, as you interact with different parts of the ecosystem. And it's a very good use case for smart contracts-based platform, because you have rules, you have the state, you can orchestrate between different players. At the same time, you can use the identity ledger or decentralized PKI, public key infrastructure, to deal with the verifiable claims, with identity, with public keys, and so on and so forth. And at the same time, various players will still have their own systems. They'll still have the private data stored. It's just the way for them to participate, to add information to the rules and state. And then identity and different claims, they serve basically as checkboxes. In the smart contracts, they make sure that everybody follows the same rules. So in that system, of course, becomes very, very expandable. There are, of course, multiple different choices in terms of platforms that you can use. Some of them work better than the others. So, it's not just a theory. We actually built multiple prototypes there. And basically, when you think about it, there's two domains: your decentralized identity ledger, your transaction ledger. And in this case, we use Sovereign, which is one of the probably best and most complete implementations of verifiable claims today as a public utility ledger. And there's Corda, which was designed initially for financial services, but actually very, very universal platform. And then we built something called Credinity. You see it at the bottom there. That's an open source technology that allows these two ledgers to coexist and talk to one another. And the application that we've built is basically a personalized medicine application where a person has a cancer, unfortunately. They have to go and supply their genetic material for a therapy center. It's a very expensive procedure, so the patient has to basically have a confirmation from insurance company that they're going to cover it. So he gets that credential that the person controls. So using that credential, he basically goes to the treatment center that's also authorized to deal with that person. A therapy center that's authorized to deal with that manufacturer. They verify the credential. They start the procedure. They collect the material. They provide the claim back to the patient that he holds on, that he can present later. So now the smart contract parts comes in and kicks in. So now we have the manufacturer starting processing your genetic material. They receive it. There's actually complex, cold storage procedure going on there. So once it's ready, we need to schedule the visit to the treatment center. We supply it to the courier. They bring it to the treatment center, and we have records of when things happened and who did what and what the conditions were, just to make sure things are still good. And finally, the patient comes into the treatment center, presents his credentials, presents his claim that was received at step number 1. They identify him, and then they administer the procedure. So two things really work together in concert. And it's a real application that we worked on, just an example. So to finalize, I think that it's important to understand there are tools out there that are new, right, that are not that well known. And identity being such an integral, structural part of the healthcare system has to be approached on a very, very solid foundation. And for that, I think we have to use decentralized identity because it does provide a secure and trustable and scalable and extendable way of exchanging that information and providing audit and patient consent as well as privacy enhancing. And of course, it might sound all very, very radical, and that's why I have Elon Musk there, because I think as we build radical systems based on radical technology, we need to have radical approaches and basically charge forward. Pretty much like Musk did with the electrical cars. Nobody believed him. Nobody believed it's possible to build a new car with a radical sales model, with a radical technology manufacturing model. But he just did it because it was very, very important. He used the right technology. He did not compromise. And I think for us to really reap the benefits that we talk about today and will talk about today, and yesterday and talk about today, I think it's important to think outside of the box and use the right tools, the right combination of technologies that do exist, and work together to make this reality happen. So thank you very much.